Beshear's mandatory face mask order took effect at 5 p.m. tonight. Now, despite a court order yesterday that blocked him from issuing further executive orders related to the pandemic, the state's attorney general asked that the judge rule on the mask order.
Means $10.4 billion to the Kentucky economy. So today I've signed an executive order that is starting tomorrow at 5 p.m. Going to mandate that Kentuckians in public in certain situations must wear a facial covering or mask. What this means is that all customers in retail facilities must wear a mask. In grocery stores, must wear a mask. In most forward-facing businesses, must wear a mask. If you are indoors and you can't get 6 feet from individuals on anything that's not covered, must wear a mask. And outside, if you cannot be 6 feet away from another individual, must wear a mask. Now, 30 days. I want to see how well we can do in 30 days. It's going to be enforced by local health departments and others, and it's going to be as simple as if someone won't wear a mask in your place of business, then they cannot be served. It's that simple. When you go into a restaurant or a bar, if you're waiting in line outside, you got to wear a mask, and inside, until you're ready to eat, we're wearing one too. We cannot let where we are, 333 cases, turn into 3,352. And the reason that Kentucky has done so well is we took early, aggressive action. We all bought in, and we did it together. Guess what? We are at that same moment.
So this is going into effect July 10th here in Kentucky. If you are outdoors, they are saying you only have to wear it in public if you are in a line or closer than 6 feet. Even though, we just saw another study that said it can travel up to 30 feet, possibly, maybe. And if you have children 5 and under, they do not have to wear it. So do not let anyone tell you otherwise. I mean, technically, by law, there's not much that can be done. Somebody can make a fuss and refuse service to you. But also if you have medical conditions, because this is going to limit the amount of oxygen you're breathing in if you are covering the area of your mouth and nose. So, those of you who have asthma, those of you who decide now you might have asthma, wink, wink. Anyway, you're probably wondering why you're looking at hats. And I just wanted to tell you about a study that me and a few colleagues conducted recently. It hasn't been published yet, but we plan on getting it published. And when it does, I'm hoping, to mandate that everyone wear masks. Masks and hats in public. Okay, so we had 2 control groups, and we put one group, we put hats on them, and the other control group, no hats. So this can be any hat, a cap, it can be, a trucker hat, a beanie, any kind of hat you want to wear. So we blew big fans in the directions of each control group, and afterwards we went and collected air samples of the air that blew past the people. And what we found was, in the air samples beyond the control group that wore the hats, there were 77% less viral particles in the air. And then we did this in an enclosed space, so, we could control for other factors. So, I know there are all sorts of conflicting evidence on this. There's so much conflicting evidence. But we've concluded that, the pores in your head are probably releasing these viral particles. And if you can just cover that area, you're releasing more into your environment. We're not sure exactly how far it goes, like a few dozen meters maybe like a room's worth. Probably about the same as the mask, we'll just say that. We'll start with 6 feet. If you're 6 feet away from someone, or closer, you should be wearing a hat. Okay. So, a hat and a mask. And I was even thinking maybe glasses too to protect your eyeball area. And eventually, maybe we could even get it to where all the pores in your body are being covered. Because as far, from what we know about infectious disease and the transmission, which isn't much, it can be coming from anywhere in the body, basically.